It's not the government's responsibility to tell me what to do.
If you guys can't run a checkbook, how in the world are you supposed to run a healthcare?
Your government has lost the faith and trust of the American people.
This is Sharyl Attkisson. It was, by any measure, a rough week for congressional Democrats.
Members of Congress are getting more than an earful. They're getting a bellyful.
How are we supposed to have any faith in you and the administration?
And the loudest bellyachers got a boost from the media, says political science professor Larry Sabato.
Whenever you have people shouting and yelling and screaming, there's hype involved. And the coverage always exaggerates the handful who do the shouting. It's the most exciting television, let's face it. But I think it's wrong to suggest that there are no legitimate concerns.
Sabato says the frustration has been months in the making.
It's about a whole wide range of issues that probably started to develop last November with Barack Obama's election. Then, as Obama started making appointments, getting a stimulus bill passed, proposing the health care initiative, all of these things further irritated the 46% who voted against him. You can almost see that the frustration and anger have built up, and the proximate cause of the explosion is health care.
I see this health bill not as reform, but pure government takeover.
You constantly hear people talk about how bad their insurance plan is, how expensive medical costs are, but as soon as there's talk of health care reform, it's like people freeze up.
It's so complicated that you can always find something in the weeds to make people frightened.
James Morone teaches political science at Brown University and is co-author of a book about presidents and health care reform, including Lyndon Johnson's fight for Medicare.
We have some wonderful telephone tapes of Johnson talking about Medicare and Medicaid. In one, he describes to a newly elected Senator, Ted Kennedy of Massachusetts, how to get a health care bill through. And he says, don't let them cost it out. Don't let them project the cost down the line. It'll kill you. And he kept trying to lowball the estimates. We argue in our book that if we'd known the costs, Medicare, one of the two most popular programs in America, would never have passed.
Now we do know the price tag for health care reform in the hundreds of billions. And for millions of voters, it's a tough pill to swallow.
The one problem we have today that we didn't have in the mid-60s is the deficit and the debt. And I really do think that that is what is causing many moderate Americans who would otherwise favor health care reform to step back and to wonder whether it's true that the president will sign a bill that won't raise the deficit.
And that could give health care reform opponents plenty to yell about in the days to come.
It certainly does seem like Groundhog Day through the years, because the problems with the health system are so acute that every time we fight this out, even when we blow it, even when it goes away, it's back again. It's like Winston Churchill says, count on Americans to do the right thing after they've exhausted all other possibilities.